Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello. Welcome to our Tuesday show. My name is Abby. Please share the show. Please share the show. Please give me a like. Whether I started already, please give me a like. Again, like I said, when you can click like or leave a comment, the algorithms put it out there so other people can see it. So, welcome, welcome, welcome to our weekly show. Just give me a few seconds here and I'll be right with you guys. Okay. I'll go back to that later. How you guys doing? Hope all is well. Welcome to our Tuesday show. As you can see, the title of the show is 5 Reasons to Get a Second Opinion. Alrighty. This is when you go see your primary care provider or go see another specialist and all that. Okay. So please, it's not gonna be a long show. Just welcome each other, share the show, share the show, share the show. And let me get my glasses on. And again, as always, I am a provider, but I'm not your provider. So please do not make any changes to your regimen without checking with your own provider first. Okay, so let's get right into the show. Let me just get my stuff together here. So when you go see your family doctor, primary care doctor, your provider, for whatever reasons you're there and they're telling you you have to take some medications or you have to do a procedure, you have to follow up and all that. You may be saying, okay, I just want to make sure I get somebody else. It's going to be something major. It's not anything. So, and also don't forget, I mean, just to make you aware that the primary care provider, we also work in collaborations with other specialists too, because we have to work within our scope of practice, meaning that what we were trained to do, we can only do that. We can't go past that. We have idea of what can be done and all that too, but we can by law we cannot go past that. So we might say you may come to see me and I've been taking care of your blood pressure. Your blood pressure has to be managed. We try a couple of different medications over time, and we'll say, okay, now it's time for you to go see the cardiologist. Maybe there's something else going on there. They need to do more specialized testing with you and more specialized training. So that doesn't mean it's like a second opinion. It just means that we're sending you, referring you to see a specialist. Okay. So, but there are times where you need a second opinion, and especially now when everything is going on and people are like not having trust in certain things, and they say, well, my doctor's saying this, and this other person I heard. A lot of people are reading their information from Google and everywhere else. My brother said this, or my friend said this, so I'm not too sure. So there will be times where you need to get a second opinion. Of course, you can ask a second opinion anytime. Now, there are times where sometimes your insurance company may not pay for it, or if you're going for a second opinion to another doctor outside of your network, that could also cause a problem too. Okay, but there are times you want to. So these are just 5 reasons. Okay, it's not a comprehensive list. All right. So let's get into the reason why you should get a second opinion. Okay. Alrighty. So let's go in there. And number one would be if you have undergone treatment but your symptoms continue. Again, like I said. Alrighty. So let's say you were going for testing, we high blood pressure, but mainly sometimes you come with other presenting symptoms that come along with it. And your primary care doctor has worked with you for a while. And it's again, like I said, let's say you took to see a cardiologist or something. What if you are seeing a cardiologist and you then say, okay, we're trying all this and this medication is not working or this other treatment is not working, they may want to see see another kind of cardiologist that's more specialist, like say electrophysiologist, or maybe you might just say, you know what, this other cardiologist, I'm not getting what I need to get from him and all that, and they've been treating my symptoms, and I'm still having high blood pressure, and I'm still having the swelling in my legs, I'm still having very shortness of breath, and this medication not too crazy about it, and he or she's not trying to give me anything, and I don't feel like it, and I'm just suffering, I'm still going through the same symptoms, I need to get help. Okay, so then again, of course, you can say, you know what, I respect you and all. I respect your opinion. I respect your expertise, but I prefer to see somebody else because maybe sometimes another set of eyes can also see things differently too. And sometimes even it may even get to a point where it's like a different doctor in that same practice. You might say, okay, I prefer to see this other person because this other doctor may look a little bit more into something, or maybe they might, let's say their training, maybe they have been doing this for a long period of time, so they know other things, and also new doctors that come into the field, new doctors or new NPs or new physician assistant and all that, they be coming into the field and they have newer training, so sometimes you combine those two trainings and all, and maybe you get a better treatment. So again, number one, if you have undergone treatments, but your symptoms continue, you can go ahead and it's also for like, especially for things like chronic pain too, because a lot of people have so many pain and their primary care doctor is taking care of it, or they go to somewhere else to be like, okay, maybe I need to see somebody who specializes in pain management. Okay, and then some pain management doctors don't prescribe certain kind of pain management pain medication either. So you may have to go to another person. They might say, okay, we don't do that here. You have to get a second opinion from another place. Okay, so those are things that you want to continue and ask for. Okay. So number two, that's not the number, but if you are diagnosed with a rare disease, now there's so many different rare diseases out there. Said there's like nearly 7,000 new rare diseases with each more discovered each year, according to the Genetic and Rare Disease Information Center. There are sometimes when you're watching TV or like you're watching you on Facebook and you see something that comes up and you be like, wow. And they say, oh, this happens to maybe like 1 in 1,000 people, or maybe you're like the 10th person in the whole world that has this disease. And you're seeing your doctor, let's say in a small town, in a nice suburban town, or wherever, like a small city, or sometimes it could be in a rural setting also. And they might say, you got that. And they say, oh, so how do I treat that? And they start thinking about, okay, how do I treat that? And you're not getting the answers. And sometimes you may have to go, they will tell you you have to go to like, a big city hospital to get treated, because like where I live and all that too, Philadelphia is like the big city around here, and they have all these universities and they have all these resources and researchers and everybody. I mean, that's what they do, teaching hospitals in all those different places. So they might say, okay, yes, we do have trauma centers where I live. Yes, we do have major hospitals where I live, but sometimes you want to go somewhere where it specializes in rare diseases, so where they can work on that and give you better answers and they give you better resources. Sometimes you may even have to go out of state to another places. That's it, because sometimes, Children's Hospital, and they may say, okay, we can't take care of you in Philadelphia. You may have to go to a hospital in Boston, or sometimes Boston have to come over here. So other places. Now, places like developing nations and all, you may have to, sometimes I see people have to leave the country and all to go to different places. So it's not necessarily like, okay, your place is not developed enough, so you don't have that. But sometimes the disease is so rare and the doctors and the specialists that take care of it, they're not too many and they're all kind of concentrated in a few places. So you may have to go there. So anything that's rare, all right. And come from a culture to where it'd be like, okay, maybe that's witchcraft. So but anyways, but then you may have to go to another seek a second opinion for that, okay? Because you don't want it may affect your life and all. Alrighty. So if the other number three is if the recommended treatment is risky, if it involves surgery, is invasive, or has lifelong consequences. Things like, let's say you go into you tell you, okay, you have to have back surgery. All right. Because most doctor will make sure that back surgery, especially like the specialists or orthopedic doctors, they will make sure, and even your primary care doctor, they will talk to you about it and tell you the risks and benefits. But some of those surgeries, certain surgeries where they'll tell you that the risk is so high and the consequences, even if there was no complications and all that too, just the healing process and everything that happens after you have that surgery, it may have lifelong consequences. Let's say you have surgery in your back and you start having weakness in your legs later on. You could have already had the weakness in your leg prior to that, but you have something else, or it caused you to, be in severe pain, severe chronic pain for a long period of time. Also, you could also have severe chronic pain for a long period of time, but this time around, and then you have to go back into there and then do additional surgery because they may say you develop scar tissue or just something didn't go right. So when they tell you, okay, yeah, this is the kind of surgery you have to have, or even like the athletes when they like to get hurt, okay, and they have to have a surgery that's going to end their season or end their career and all. Of course, you want to get a second opinion on that. So just say athletes have money, but of course, if they don't have that money coming in anymore, that could end their career, especially if they're still young and all. So it's important. So if that's what you're doing, call and say, you know what, let me just check with another person. Okay. I respect you and all that. And that doctor or that person who's talking to you, and if they're comfortable in the skills and comfortable in everything they're doing, they would say, okay, yeah, go ahead, go check somebody else first. And then you can come back. And then if you so want to do it, let's go ahead and do it. Or me and that person can collaborate. Now you might say, okay, well, you're going to be talking to the person who I'm doing a second opinion to. How do I know you guys are not just saying the same thing? Then you can also say, get somebody who's completely different. Alrighty. Because sometimes, again, like I said, once that doctor feels comfortable, your provider feels comfortable, what they're going to be doing, they'll say, okay, yeah, go ahead, get a second opinion. And if that person, and then weigh the ways and consequences, again, like I said, if if somebody says, oh yeah, you have to major surgery and all that too, or something happening, and the person said, another person might say, okay, let's continue with some medications for line, let's do some other thing, let's do some physical therapy, let's do another stuff. So if their resources or their choices that they're giving you are so far between, you might say, oh, let's see there has to be like a little, they have to be a little closing together, say, okay, maybe yeah, the other doctor did tell me that and all that, and it did tell me all the different things that be going on. So yeah, I just want to make sure that I can make the decision and have somebody with you too when you go to the second opinion person too. Okay, your first opinion and the second opinion person. Again, like I said, if you cannot have somebody with you, if you go in there, tell the doctor, tell the staff and all that, I got my relative on the phone. Sometimes you might say, okay, what that relative specialty is or their background. They don't necessarily have to be like a healthcare person, but this person just wants to listen in because this is a person that helps me make my decision. So I can, is it okay that they listen on the phone and all that? Okay. Because sometimes when you're talking to your doctor, that doctor may say something that's personal that you don't want the other person to hear. So you want to let them know that, okay, yes, I have somebody on the phone. We're going to be talking directly just about that. Okay. Because sometimes things come up and they'd be like, oh my God, I didn't know you had this. I didn't know this was going on. So it's important that you tell them that I got somebody on the phone and can they just listen so they can also help me make that decision if I do leave from here. And you don't have to make decision that same day either. You can say, okay, you let me think about it. I'll get my second opinion person and I'll come back to you guys. Okay. Alrighty. So the next one is get a second opinion if you're diagnosed with cancer. Now, cancer is like it's such a big deal and it's like a scary thing for everybody. Alrighty, regardless of where you are. And then certain kind of cancers too, or like you hear that and then right away it's like, okay, not start making your will and all that too, but there's certain cancers that are like worse than the others. Cancer is cancer, but there's certain one some of them what their cure rate is so low, or all the different treatments and all that, talking about years and years and everything else that comes along with cancer. Because when you get into treatment, I mean, hair loss, you look blood loss, everything else that comes along with the treatment and losing your job. So if they tell you, okay, this is what you're diagnosed with, and we can go in there, maybe we can just do a biopsy, maybe we can just go in and take out the nodule or take out the mass, and you'll be fine. You don't have to get chemotherapy, you don't get to have radiation and all that. So this one, it looks like for you do your research. And most of the time, let me just say this: most people saying they're doing research, you're not really doing research because you're not just looking. You go on Google, you have to Google competently. Okay, you can just go in there and say, oh, because most of the time you see something that's confirm your bias and all that. So it's important that you go into like the National Institute of Health, the CDC, and World Health Organizations. Those are the kind of places you want to be looking. And of course, you can go to any kind of medical library in your place there and talk to anybody there. Okay. But of course, you're gonna be talking to any kind of research. You talk to your doctor first. All right. So if they tell you that, and it says, okay, breast cancer, and I have breast cancer. Oh my goodness, that okay. I have to be talking to the breast center. I have to be talking to the cancer center. I got to be talking to the nutritionist. I got to talk to my family and things like that. So if you say, okay, I don't know, but they would have gotten the mammogram, they would have gotten the ultrasound if they need to follow. They would, sometimes they're not going to go there and say, okay, let's take your breast off. They'll go to where it is and take the nodule out and go study it first and come back and say, okay, this is what we're seeing. Okay, we're all gonna make sure to look this not hasn't spread anywhere else. Certain cancers don't show up until it's like at stage 4, and stage 4 is like the worst. Okay, and certain cancers, depending on where it is, it makes it so much more complicated. So if that's the case, they're asking you to tell you, say, okay, this is what we're looking at. Go ahead, take that test and you say, give me my records and all that too. And I just want another set of eyes to look at it. And again, like I said, that doctor who's going to be following you will know that, yeah, okay, because it's something serious. It's not something no doctor will tell you, let's just get right into it. I mean, depending on how severe it is, I've seen some people who have breast cancer who didn't go check right away. And they already had like the whole breast and everything had all these different open wounds. And it's like, okay, you're here right now. We have to go right into the testing. We have to go right into the treatment right away. Okay. And even then you can say, no, I want a second opinion, and nobody's going to stop you. Okay. So that's important. And get a second opinion if your gut reaction tells you that something is off. Okay. By all means, it's like not saying, oh, nobody's going to come out. No provider is going to come out. No doctor's just going to come out and just tell you, this is what you have, and you'd be like, okay. And now, especially now, like I said, when a lot of people are not trusting health professionals and not trusting certain institutions and all that. So, but sometimes you just say, you know what, I just something about this person, or just something about what they're telling me doesn't seem over. Don't just go there blindly and saying, you're just saying that because you think, oh yeah, I don't trust this person. I'll do this. And first of all, you have to trust a doctor. You have to be comfortable with the person who is taking care of you. Okay, so if you have any doctor that's taking care of you and you don't feel comfortable, you don't feel respected, you don't feel like they're listening to what you're saying, and they're just like talking over you or sometimes or dismissing what you're saying, and because they'll be like, oh, this one, and even sometimes because if you're scared and you're telling your doctor, I'm scared, I don't think this is it, and they just say, oh, maybe you're just under stress, maybe you're just under this. Of course, for that reason, you have every right to leave that doctor. You don't have to stay there. But like I said, if this is saying just something off and you just don't feel, I don't feel that this is what I need to do and all that, get a second opinion. And that person also, again, if that person is sincere, which they're supposed to be because they're bound by law, they will tell you, okay, go ahead and get a second opinion. And then come back here. But and then sometimes, like again, like I said, doctors take different approach. We'll all have to follow guidelines and all that, but certain doctors, even sometimes within the same practice, might take different approach. Okay, to say, okay, okay, let's say let's do this, let's try more medication, or let's do this other thing because we've been looking at this, we've been trying this is not working. And also feel free to say, let me just go and find something else. You trust your gut. You're the person that I always tell my patients, it's your body. Okay, it's your body. So that person is the health professional, but it's your body. So if you feel that something is off and all that, to get a second opinion. And that's with everything too. Okay, so get a second opinion and say, I just need, and like again, like I always tell people, if you're a praying person, pray about it. Speak to people who are knowledgeable on the fact. Don't just so say, my cousin this, my cousin said this, my cousin said that, because a lot of people who are also afraid of, oh my God, I'm not taking that medicine because I heard this and not taking, and there's so many things online. And if you don't, so I heard this study, but most people were like, oh, there's this study that said this, but you don't go and read that study. You don't see how many people were tested. You don't see the sometimes the race of the people that were tested, or the class, meaning like the money. Because what if they test a lot of rich people, okay, that said for the study, and then they came up with this conclusion? But they'll also tell you the study limitations too, because the researcher tell you these are the study limitations. We did testing on these people who all live in this area, and so, and for further research, they will tell the person who's going to pick up the research and then say, these are the, okay, this is what we did, I need you to follow up and do different people, because you may get different responses or different answers to your research when you test different people from different backgrounds, different cultural backgrounds, different class backgrounds, different all of that. Okay, so that's the thing I say when people say, oh, I'm just doing my own research. They don't go back. They hear online, they read something, a little tip here and there, but they don't read the entire thing. They don't go back and read it, because who's got time to be reading that? And sometimes it's all the medical jargon is too much that you're not going to understand it anyways. But take the time to like read the research itself. If you're on Google, you can see where they took the article from, and then go to the article, and then go to where they took the article and the research they took the article from. Okay, so that's it there. And then also, I know it says 5, but the next one is say, if the patient is your child or a minor. Okay, did I put my minor? I'm so minor wrong. But yeah, so of course, if it's your child, and they're telling you all these things I just said, you need surgery for this. Your child's like an athlete in school, or your child's in school, and anything that's gonna sit there and affect their lives and affect your life and all that. Let's say cancer, any kind of surgery, any kind of rare disease, all of that applies. But especially if your child's a minor, you want to make sure you go there and get, say, okay, well, let's get a second opinion again, because this is my child and I'm a little nervous and I don't want anything happen to them as a parent. I want to make sure I got all the answers. I've exhausted every other avenue, and I want to make sure my child's going to be okay before I go ahead and agree to something that's going to have lifelong consequences, or again, like I said, cancer and any things like that. Okay. So, and I'll be done soon. So, what to ask during your second opinion? Let me just see here for a second to come in. Okay, Steve. Oops, sorry. Steve said, good evening, Abby. Hi there. And Kalua said, patient information always, Abby Tyler. Thank you. Thank you. Thank you, Kalua. Oh, my big sisters. Thanks, guys. So just quick summary of what to ask during your second opinion. Okay, so let me just go in here. And again, talk with your insurance company, because again, unless if you're like independently wealthy, of course, it's going to affect your insurance. And also, you can ask your doctor for a second opinion. You can call the insurance company and say, do you have another doctor? Because you may say, okay, if I have anything with this doctor, this same doctor is going to be recommending a second opinion. So and I want somebody completely different. So you can call your insurance company and ask them. All right. Okay, so when you go see your for the second opinion, you can say, "Oh, by the way, let me ask some questions." So bring a notepad with you, okay? So you can ask, so could there be a different diagnosis explanation for my condition? Because this doctor say I have cancer. This doctor say I have severe back pain and I need to have surgery. Could it be something else is going on just in case? Because you're gonna have all your records there too. That doctor's not just gonna be going ahead and just making things up. All right. So they would have read everything before you come into the room and then kind of go over it and get your history, ask you all of that, and then go on that. Or you can ask you, what treatments do you recommend for it? Okay, they're recommending this. Are you recommending something else? Are there any other variable, viable treatments that I consider? Okay, so again, like I said, do I have to do this? Can I try something else that's going to be just as good? Or can I do step by step until I get to this one that I don't necessarily have to go right away? Again, like I said, depending on your symptoms, depending on the test results and everything, you may need to go right away. Okay. Are there any additional testing I should have? Okay, they say, oh yes, I had a mammogram, I had an ultrasound, and sometimes some other places are also recommending that you can also have, you can have MRI, let's say for your breast, because more detail. Some insurance company, because it's very expensive, they may not say that. They may say, no, this test shows this, and this other test show that. So what are you looking for again? All right, so if you're willing to pay for it and you want to do more, go ahead and do it. Okay. Are there side effects associated with the treatment options? Okay, so whatever the first person is recommending and what the second person is recommending too. Of course, they're going to tell you you're going to have this. This is all going to happen. This is what you're going to be expecting to happen. These are the things that we're going to expect. Okay, so and there are things that are going to show up that we're not expecting to. So that person is supposed to be able to explain all that to you, and then you're comparing that to what the other doctor told you. All right, how long is the recovery period for each treatment? And they will tell you, oh, you're going to be out of work or out of school for 2 weeks, as opposed to like 3 months, or opposed to like 6 months. And you're talking about, oh my God, I have to worry about my bills, I have to pay my bills, I have to take care of my children, I have to do this. Even if you're a two income household, to one income moved away, that can also cause a problem. Who's going to watch my kids when I'm going to treatment? Who's going to take care of the baby? What if you have a baby? Who's going to take care of my elderly relative? Because sometimes your elderly mother or father or elder person could be there, and maybe you went to the house to take care of them, or maybe to live with you and all. So all of that you have to take into account, because that's the reason why people are like, oh, let me just hold off on my treatment yet. I know a lot of people who don't show up for anything because they're being so worried about everything that may happen. All right. And then how much will each treatment cost? Is it covered by insurance? Like I say, at the end of the day, insurance, and all that. So unless if you're wealthy, then you can do that. Certain things you can pay out of pocket, but it gets a little more expensive. And then that's why you see some people doing fundraiser. I see other ways where people do on TikTok where they get into the creative fund, and then you watch the video for like a whole minute, and then they can get some money. You're not paying anything. You just so there's so many other ways that to get it, and you can talk to your social worker that's associated with your doctor's office, or social worker that's in the community, but there's so many resources out there too. So even though you're getting a second opinion, and the second opinion confirms what the first person said and close enough to it, you may need extra help with all the different people in the community. So it's important that you get to know that. And again, like I said, it's important that you be comfortable with your doctors. If you're having any issues, that you can discuss that with them. Okay, so those are the reasons to get a second opinion. Alrighty, let me go back here for a second. Okay, so I'll go back, and it says, if you have go back, just gonna go back there. If you have undergone treatment but still your symptoms continue, if you are diagnosed with a rare disease, if the recommended treatment is risky, involves surgery, is invasive, or has lifelong consequences, if you're diagnosed with cancer, if your gut reaction tells you that something is off, if that patient or the person who's being treated, if that person is your child or a minor. And then I also went on to the questions you're supposed to ask when you go for your second opinion. Okay, so feel free to ask your doctor, say, I just need to know. I just need to know, because and like I said, that if that doctor, provider, if they feel comfortable and they're which they're supposed to anyways, and they're comfortable in their skills and expertise and all that, they'll tell you, go ahead and get a second opinion. And don't think that, okay, that we have guidelines to follow, so the other person opinion may not be too far from it, but they, like, again, like I said, somebody may have have had more training over the years and they have more tools to pick from. Somebody also who just come into the field for a couple of years too, maybe coming with new treatment options and all. So sometimes it's good to have you go to a practice where you have like younger and older doctors and all that too. Sometimes the diversity helps because coming from a different background too, you can also understand. Okay, I'm dealing with this subset of people, and I can see it differently, and different set of eyes can see different things too. Okay. So I don't see any other questions there. And if you have any more questions, just leave that in the comment section and I'll answer. I usually go back and forth and answer it during the week already. And of course, if you have any questions that has to do with the forum, you can go ahead and just inbox me on that, only if it has to do with that, please. All right. And thank you all for watching. As always, thank you all for watching. Thank you all for your love and support. Please don't forget to share the show. Please give me a like. Please give me a like. Again, like I said, it goes into the algorithm and other people see it as well. Okay. So thank you all for watching, and leave your questions and comments below and I will go back and answer that. Okay. So thank you all and have a beautiful night. Bye bye now.